I'm going to perform a full evaluation of an upper thoracic segment. On a visual basis, you'll know you're in the upper thoracic spine during your general scan because you're going to be superior to the base of the spine of the scapula. Between the base of the spine of the scapula and the lower aspect of the cervical spine is the middle thoracic spine, the upper thoracic spine. To fully assess this region, just like we did with both the middle and the lower thoracic spine, we're going to assess flexion and extension, right and left lateral bending, and right and left rotation of the thoracic segment, and we're also going to assess depression and elevation of its rib pair. The only difference in the upper thoracic spine versus the middle and lower thoracic spine is movement in the upper thoracic spine is more influenced by cervical motion than it is by torso movement. So to that end, we're going to utilize all these movements. We're going to utilize the head to assess both joint play and end feel. As a matter of point, I'm going to be using the T1 segment as a representation. To locate the T1 segment, I'm first going to locate the vertebral prominence. Do me a favor, can I have you bend your head forward? Looking for the most prominent spinous, I'm going to place my finger upon it and the adjacent spinuses. To help me locate myself, I'm going to passively flex and extend the head, looking for the last retractable spinous, which is going to be the C6 spinous process. And from here I know that I can sit and I can palpate down to the T1 segment. For the T1 spinous process, the first thing I'm going to assess is both for flexion and extension. To this end, my contact is going to be the interspinous space between T1 and T2. From here I'm going to flex and extend the head, and what I should feel as I flex is I should feel that inner space widen or open up, and as I extend the head I should feel it close down. Now in your general scan, as a matter of point, what we've done when we're looking for that segment, we kind of keyed in on the segment that doesn't tend to open up well or close well, and for argument's sake I'm going to take the T1-2 segment here. So in this case here, he didn't seem to open up as well as I thought he should have. This would be looked as being on a flexion restriction, or also could be looking Gonstead listening system as a posterior spinous, or P. Just like we did in every area of the spine, I'm going to look for both rotation and lateral bending. For rotation, I'm going to take my thumb pad, place it on the side of the lateral aspect of the spinous of T1, as well as spying on T2. But this time I'm going to utilize the head to assess both joint play and end play. To assess left rotation, I'm going to take the head and rotate it to the left. I do feel separation or joint play between T1 and T2 in left rotation. To assess end play, I bring the joint to pretension in the motion that I want to assess, in this case left rotation. And then lightly I'm going to spring from lateral to medial on that spinous process, feeling the resiliency or lack of resiliency in that joint. And I can do the same thing for right rotation by just changing my sides. I'm on the lateral aspect of the spinous process of T1, spying across the inner space on T2. I'm going to take the head and passively rotate it to the right this time, in which case I feel a lot more joint play in right rotation than I did in left, although there was joint play in left rotation. To assess end play, I'm going to lightly spring through this joint, and I feel this joint to be a lot more resilient than the other side would. So if anything, I was going to say he might have a minor problem in left rotation. In the Gonstead listening system, this would be your PL spinous. For lateral bending, once again, I'm going to take the head, and I'm going to assess both joint play and end play. I'm going to passively laterally bend the head to the right. What I should feel is separation and movement between the two spinuses. Now I don't really feel much joint play in this case in right lateral bending. The caveat with lateral bending is when you go to assess end feel, if you maintain a light touch, you could probably get by with just holding your hand on top of the head, bring the joint to pretension, and lightly just springing through that joint. On the other hand, if you tend to be heavy-handed, sometimes what you'll do is you'll end up compressing the head, and it kind of jacks up the upper cervical spine. So to that end, another alternative for springing through this joint is to bring the joint to pretension, take your hand, support the lateral aspect of the neck so that when you spring through you have a nice backboard And it tends to, for the most part, it allows you to stabilize this without injuring the upper cervical spine. I'm going to assess joint play and end play in left lateral bending by coming over to the lateral aspect of the spinous processes of T1, T2, passively laterally bending the head now to the left. I can't really say that I feel much joint play in left lateral bending either. Although he's a little bit more resilient in left lateral bending than right, the joint play wasn't as much as I anticipated. So because of this, one of the things we have to take a look for in the thoracic spine, we've looked at flexion, extension, right and left lateral rotation, and right and left lateral bending. We also have to consider its rib pair. Since I'm dealing with the first rib, the easier way to find the rib pair of the first rib is not to go through the bulk of the back of the trap, but instead come over the anterior aspect of it, and as Dr. Baggett had in her palpation class, we're going to wrap the class. We're going to wrap the trap. My segmental contact point to assess both elevation and depression is going to be the superior aspect of the first rib. So I'm going to come over the medial aspect of the trap, anterior trap, at the base of the neck, and I'm going to pull it lightly back. I'm going to wrap the trap, and I should feel that flat aspect of the superior aspect of the first rib. If you want to feel joint motion or good joint play, what you can do is as I slide medially along that rib, you're going to feel the flat of the rib, and as you come towards the base of the neck, you might feel this little bit of a rise, which feels like a little bump, which we jokingly call a bimp. That is actually the costotransverse joint. If you put your finger right in that articulation, the joint line, you actually feel movement between the two segments. To assess elevation, we're going to utilize the head instead of the torso. Just as in the thoracic spine, elevation is the combination of one of the following. Inspiration, taking a deep breath in, I should feel the rib rise. Flexion of the head, I should also feel the rib rise or elevate. Rotation away from the side of contact, or lateral bending away from the side of contact. All of these will elevate that rib, and I should feel movement between the transverse process and that first rib. As per phase work, I'm going to combine all three. Flexion, contralateral rotation, contralateral lateral bending. And I should feel that rib rise, in this case on the right side. And I do. And I'm going to assess the left side. He elevated better on the right side than on the left side, although there is movement here on the left as well. To assess depression, depression is going to be the combination of one of four things. Forced expiration, extension of the cervical spine, rotation towards the side of contact, or lateral bending towards the side of contact. As per phase work, we're going to combine all three. What I should feel with my finger in the costotransverse joint is movement between the TVP and the rib, but I should also feel the rib move or drop down away from me. If the rib stands its ground, it implies that the rib is restricted. So to that end, I'm going to passively extend, ipsilateral rotate, ipsilaterally laterally bend, as if he's looking over the left side of his shoulder. I don't feel much depression of this first rib. It pretty much stands its ground as I do this. I'm going to assess his right side. While there's a little bit more movement over here, of the two, I was going to say his problem seems to be a little bit more of a depression problem on his left side than his right side. Although that right side, I expected it to move a little bit more freely. And that would be a full evaluation of an upper thoracic segment. Flexion and extension, left and right rotation, left and right lateral bending of the thoracic spine proper, and also elevation and depression of its rib pair.